Across the country, people tested for COVID suddenly ending up with bills. Bills the U.S. government promised Americans they would not get. As part of the Rebound Green Country, 2 Works for You's Karen Larson has a closer look at why some insurance companies aren't doing what's right.
Long before an epidemic swept across the globe, Anna Davis Abel was already spending her days trying not to get sick. She's 25 years old and has been living with a chronic illness for most of her life.
The way that everyone feels right now is like the way that it always feels to live with a chronic illness.
It was early March after returning home from a trip when Anna started feeling sick. Even after taking a terrifying trip to the doctor, Anna was told there were no tests in the state of West Virginia where she lives, and her symptoms only got worse.
I was going from being super sweaty to like really cold. I developed a cough probably on like the 3rd or 4th day.
When that didn't get better, Anna was given a COVID test, a test that under federal guidelines was supposed to be covered by her insurance company. Imagine her surprise when a bill for $536.46 showed up.
I think it shows, unfortunately, that at the end of the day, it's a healthcare industry that's not first about health.
So what's happening here? The CARES Act mandates COVID tests be covered by insurance companies. But as Americans are finding out, there are loopholes. Many times the tests aren't billed correctly. Or in Anna's case, she was tested before the law went into effect.
Most people, when they get a medical bill, they're frustrated, they're angry, but they don't really know anything that they can do about it. And I feel like that's what the insurance companies are really relying on.
The COVID-19 billing and medical debt is going to be a nightmare.
Craig Anico is the co-founder of the RIP Medical Debt. His concern is that many of us will just assume COVID tests were covered and then months later end up with a bill.
People aren't going to start feeling the pressure of paying these bills until almost a year from now.
As for Anna, after calling her insurance company multiple times, they finally forgave the charges.
As the discourse moves past the initial fears that we had, there's going to be less pressure on the insurance companies to be held accountable.
Karen Larson, 2 Works for You.
And here's what you should do if you think you've been charged incorrectly. Don't ignore or let yourself forget about the charge. Ask for an itemized copy of your bill so you can see and evaluate each charge individually. You might spot more errors that way. Then try to get someone from your insurance company on the phone to resolve the problem. As a last resort, consider filing a complaint with the State Insurance Commission.